Welcome to Medical Specialists Associates educational series on topics in critical care medicine. I'm Christopher Voss, MD, MS, FCCP, board certified in anesthesiology, critical care medicine, neurocritical care medicine, and critical care echocardiography. Today, we're focusing on the use of half-dose tissue plasminogen activator, or tPA, in treating submassive pulmonary embolism, also known as PE. This is a critical area of study, as submassive PE represents a significant health risk, and the potential to reduce complications while effectively managing the condition could save lives. Understanding submassive pulmonary embolism. Pulmonary embolism occurs when a blood clot blocks one or more arteries in the lungs. Submassive PE is a category of PE where there is evidence of right ventricular strain or dysfunction, but without systemic hypotension. This condition is serious and can lead to worsening heart function, respiratory failure, and even death if not treated effectively. The traditional approach to treating PE involves anticoagulation therapy, and in more severe cases, thrombolytic therapy. However, the use of thrombolytics like tPA at full doses is associated with significant risks, particularly bleeding complications. This has led researchers to explore the potential of using reduced or half-dose tPA to achieve a balance between efficacy and safety. The case for half-dose tPA. Evidence from research. Recent studies have provided compelling evidence supporting the use of half-dose tPA in treating submassive PE. Here's a deeper dive into the research. 1. The MOPET trial and case series evidence. One of the most influential studies in this area is the MOPET trial, which explored the effects of using low-dose tPA in patients with submassive PE. This trial demonstrated that patients treated with low-dose tPA experienced significantly reduced rates of pulmonary hypertension and recurrent PE compared to those who received standard anticoagulation alone. Importantly, this was achieved without an increase in major bleeding events, which is a common and serious side effect of full-dose tPA. In addition to large trials, case series have also provided valuable insights. For instance, a 2020 case series published in the Journal of Pharmacy Practice highlighted 5 patient cases where low-dose tPA was used to treat submassive PE. All patients experienced a successful resolution of symptoms, improved vital signs, and better laboratory values. Importantly, none of the patients in this series experienced any bleeding complications during or after the administration of tPA, further supporting the safety of this approach. 2. Patient populations that may benefit from half-dose tPA treatment. Research suggests that certain patient groups might benefit more from half-dose tPA. For example, patients with a low body weight, the elderly, and those with significant right ventricular dysfunction have shown favorable outcomes when treated with reduced doses of tPA. A study published in Annals of Pharmacotherapy in 2015 emphasized that major bleeding complications of tPA are dose-dependent. Therefore, using lower doses can reduce these risks, particularly in vulnerable populations. Another study published in the Journal of Investigative Medicine in 2021 specifically examined half-dose tPA in patients with intermediate-risk PE, which is often classified as submassive. This prospective, non-randomized trial found that patients who received 50 milligrams of tPA alongside low molecular weight heparin had significantly fewer deaths or instances of hemodynamic decompensation within the first 7 to 30 days compared to those who received heparin alone. Crucially, this benefit was achieved without increasing the risk of major bleeding, making half-dose tPA a potentially safer alternative for this high-risk group. 3. Insights from comparative studies and systematic reviews. Comparative studies have also shed light on the effectiveness of half-dose versus full-dose tPA. A retrospective cohort study analyzed data from over 3,000 patients treated across 420 hospitals. The study found that while half-dose tPA was associated with a lower risk of major bleeding compared to full-dose tPA, it also led to increased treatment escalation. This included secondary thrombolysis and catheter-directed thrombus fragmentation, suggesting that while safer, half-dose tPA might be less effective in some cases, necessitating additional interventions. Despite this, the overall hospital mortality rates between the two dosing strategies were similar. indicating that half-dose tPA might still offer a valuable balance between safety and efficacy. Additionally, a systematic review highlighted that half-dose tPA is particularly useful in patients who are at high risk of bleeding or those who might not tolerate full-dose therapy. This includes elderly patients, those with low body weight, and those who have recently undergone surgery or have other conditions that predispose them to bleeding complications. Patient outcomes and long-term considerations. Research not only supports the use of half-dose tPA in the short term, but also suggests long-term benefits for patients with submassive PE. For instance, a 2020 study published in Circulation. Cardiovascular interventions examined patients over a year after receiving lower-dose tPA through ultrasound-facilitated catheter-directed thrombolysis. The study found sustained improvements in right ventricular function, as well as significant enhancements in functional status and quality of life. These findings are crucial because they highlight that the benefits of reduced-dose tPA extend beyond the immediate treatment period and can lead to better long-term health outcomes for patients. Moreover, for patients with specific complications such as pulmonary hypertension or recurrent embolism, the use of half-dose tPA has been shown to provide significant clinical benefits without increasing the risk of intracranial hemorrhage or other severe bleeding events. This suggests that half-dose tPA could be a safer, yet effective option for maintaining long-term cardiac and pulmonary health. In conclusion, the growing body of research supports the use of half-dose tPA as a viable treatment option for submassive pulmonary embolism, particularly in patients at higher risk for bleeding complications. The reduced dosing regimen has been shown to provide effective treatment outcomes, such as improved right ventricular function and reduced recurrence of PE, while minimizing the risks associated with full-dose thrombolytic therapy. As always, while these findings are promising, more large-scale, randomized, controlled trials are needed to further validate the efficacy and safety of half-dose tPA across broader patient populations. However, for now, this approach offers a promising alternative that could significantly improve patient outcomes in the treatment of submassive PE. To learn more about critical care medicine, please visit us on our website at www.medspecialists.net and subscribe to our YouTube channel.